Welcome back to the Diabetes Health Channel, your go-to source for all things related to diabetes management and health. In today's video, we'll be discussing a topic that is of critical importance for people living with diabetes. How does diabetes affect the heart and what you need to know about it? Heart disease is a general term that refers to any condition that affects the function or structure of your heart. It includes coronary artery disease, CAD, which occurs when plaque, a fatty substance, builds up on the walls of your arteries and narrows them, reducing blood flow to your heart muscle. This can cause chest pain, heart attack, or sudden cardiac death. Heart disease also includes stroke, which happens when a blood clot blocks an artery that supplies blood to your brain, or when a blood vessel in your brain bursts. People with diabetes are more likely to develop heart disease than people without diabetes. This is because high blood sugar levels can damage blood vessels and the nerves that control your heart. Over time, this can lead to medical issues such as atherosclerosis. This is the hardening and narrowing of arteries due to plaque buildup. Atherosclerosis can affect any artery in your body, but it is especially dangerous when it affects the arteries that supply blood to your heart called coronary arteries or brain called carotid arteries. Atherosclerosis can reduce blood flow and oxygen delivery to these vital organs, increasing the risk of angina, heart attack, stroke, and peripheral artery disease, which affects the legs. Heart failure. Heart failure occurs when your heart cannot pump enough blood to meet your body's needs. This can cause fluid buildup in your lungs, legs, or abdomen, shortness of breath, fatigue, or irregular heartbeat. Diabetes can damage blood vessels and make the heart muscle stiffer, which eventually leads to problems with fluid retention and heart failure. Hypertension. This is high blood pressure, which means that the force of blood pushing against the walls of your arteries is too high. High blood pressure can strain and damage artery walls, making them more prone to plaque formation and rupture. High blood pressure can also increase the workload of your heart and damage its muscle tissue over time. Dyslipidemia. This is an abnormal level of fats, lipids, in your blood. People with diabetes often have too much low-density lipoprotein cholesterol, bad cholesterol, and triglycerides, a type of fat, in their bloodstream. These lipids can form plaque on damaged artery walls and contribute to atherosclerosis. People with diabetes may also have low levels of high-density lipoprotein cholesterol, good cholesterol, which helps remove excess LDL cholesterol from the bloodstream. Arrhythmia. Arrhythmia is an abnormal heartbeat that can be too fast, too slow, or irregular. Diabetes can damage the nerves that regulate your heartbeat and make it more likely for you to develop arrhythmia. Some types of arrhythmias can be life-threatening if not treated promptly. Autonomic neuropathy. Diabetes can cause damage to the nerves that control the heart and blood vessels. This can lead to abnormalities in heart rate and blood pressure and increase the risk of heart attack and sudden death. Inflammation. Diabetes can cause chronic inflammation in the body, which can contribute to the development of atherosclerosis and increase the risk of heart disease. Fortunately, there are ways to prevent or manage diabetes-related heart complications. Some of the steps you can take are: keep your blood sugar as normal as possible. This can help prevent or delay damage to your blood vessels and nerves that affect your heart. You can monitor your blood sugar levels at home with a glucose meter or a continuous glucose monitor, CGM. Control your blood pressure with medication if necessary. High blood pressure puts extra strain on your heart and increases your risk of heart disease. The target for people with diabetes is under 130 by 80 millimeters of mercury. Get your cholesterol numbers under control. You want to lower your LDL cholesterol and raise your HDL cholesterol to protect your heart. The target for people with diabetes is LDL below 100 mg per deciliter and HDL above 40 mg per deciliter for men and above 50 mg per deciliter for women. You can check your cholesterol levels with a blood test every year. Lose weight. Obesity increases your risk of diabetes, high blood pressure, high cholesterol, and heart disease. Losing even a small amount of weight can improve your health and lower these risks. For the #1 weight loss supplement for diabetics, simply click on the link below the video. Exercise regularly. Physical activity makes your body more sensitive to insulin, the hormone that allows cells in your body to use blood sugar for energy, which helps manage your diabetes. Physical activity also helps control blood sugar levels and lowers your risk of heart disease. Quit smoking. Smoking damages your blood vessels and increases your chances of developing other long-term problems such as lung disease, lower leg infections, and ulcers, foot or leg amputation. Smoking also makes it harder to control your blood sugar levels and increases your risk of heart disease. Reduce stress. Stress can raise your blood sugar levels and affect your mood and mental health. Stress can also trigger unhealthy behaviors such as overeating, smoking, drinking alcohol excessively, or skipping exercise. To cope with stress, try relaxation techniques such as deep breathing, meditation, yoga, tai chi, massage, or listening to music. By making the above changes, you can improve your quality of life and reduce the chances of developing diabetes-related heart complications and live a healthier life even with diabetes. That's all for today. If you enjoyed today's video, then feel free to smash the like button and subscribe to our Diabetes Health channel for more videos in the future. Take care now.